Now we will continue with our yesterday's topic, role of the government in health. Public health service is a chain of health center and hospital run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kind of problem from common illness to special services. At the village level, there are health centers where there is usually a nurse and village health worker. They are trained in the dealing with common illness and work under the supervision of doctor at the primary health centers. What is primary health center? It is called PHS, public or primary health centers. Such a center cover many villages in rural areas. At the district level, it is district hospital and also supervise all the health centers which is in the district area. Large cities have many government hospitals, such as one where Aman was taken, where Aman was went for the treatment, and also specialized government hospitals such as one in Hakim's Sheikh story. So recall the Hakim Sheikh story and where he was admitted. So those hospitals are the government hospitals in the large cities. So both these public healthcare systems exist in rural area as well as urban areas. But if it comes in the multiple specialty hospital, they would exist only in which area? Urban area. Why? Because rural areas would not find that much drainage or that much facilitated and that much paying capacity to sustain the multi-specialty hospital. So, under the rural areas, we have the registered medical practitioners who are known as RMPs. Under the urban areas, we have services. Specialized services, we have diagnosis. These diagnosis service are in the form of CT scan, MRI, ultrasound, sonography, and so on. There are very various pharmaceutical shops also which are involved in private healthcare systems. So, so we can see the different healthcare system in different level, at village level, at district level, and in large cities also. The health service is called public for many reasons. In order to fulfill its commitment of providing healthcare to all citizens, the government has established these hospitals and healthcare centers. Also, the resources needed to run these services are obtained from the money. From which money? Yes, we pay taxes. So on these taxes only, the government give money or the funds to these hospitals. One of the most important aspect of the public health system is that it is meant to provide quality healthcare services either free or at a low cost so that even the poor can seek treatment. Another important function of public health is to take action to prevent the spread of disease such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. Yes, it is in rural area as well as in urban area. Yes, in Prem, if you see in the urban areas also, they are not that much hygiene. We never visit to this government hospital, so we don't know about it. Okay, so this has to be organized by the government with the participation of people, otherwise it is not effective. For example, so you can take the example nowadays for government hospital, nowadays for this in this pandemic also. In if you go in government hospital, they uh, gave you treatment free, otherwise it is at low cost. But if you go in private hospitals, so they charge more. So when talking up a campaign to see the mosquitoes do not breed in water cooler, rooftop, etc., this has to be done for all houses in the area. So if you remember the story of Hakim Sheikh, so if you might have doubt here, or if you would you like to know that the court what they filed the case isn't it? Till the at the end we have seen that they filed the case in the court. Yes. So according to our constitution, it is primary duty of the government to ensure the welfare of the people and provide healthcare facility to all the people. So who is at fault here? According to law also. So the government must safeguard the right to life of every person. The court said that the difficulty that Hakim Sheikh had to face could have cost him his life. Yes, he was at the very critical situation, and then also he didn't get the facility from this hospital, so they were at fault. So court said that the difficulty of Hakim Sheikh had to face could have cost his life. So, if a hospital cannot provide timely medicine treatment to a person, it means that this protection of life, this right of life, is not being given by the hospital. So, the court also said that it was the duty of government to provide the necessary health service including treatment in emergency situations. Hospitals and medical staff must fulfill their duty of providing the necessary treatment. So Hakim Sheikh was denied treatment at various government hospitals. How many hospitals he went?
14.
Yeah, great. So so many hospitals, 14 hospitals denied treatment at a various government level hospitals. So therefore court asked the state government to give him the money that he had spent on his treatment, but he has suffered a lot, though he get the money after the treatment, but he has suffered a lot, so it should be avoided. Now let's talk about private healthcare health facilities. There is a wide range of private health facilities that exist in the our country. A large number of doctors run their own private clinic. In the rural areas, we find registered medical practitioners, RMPs. Urban areas have large number of doctors, many of them providing specialized services. There are hospitals and nursing homes and are privately owned. There are many there are many laboratories and they do test and offer special facilities such as X-ray, ultrasound, etc. There are also shops from where we buy medicines. We have discussed this in starting only. As the name suggests, private health facilities are not owned or controlled by the government. Public healthcare systems are controlled by the government, but as the name suggests, private, it is private. So private healthcare facilities are not controlled by the government, so they don't get the fund or any money to run these hospitals. So unlike public health service in private hospitals, in private facilities, patients have to pay a lot of money for every service that they use. So they have their own funds and their own profit. So they are rising because of which they are running the hospital or private clinic. So what happened under private healthcare system is ultimately there is more burden on the whom doctors or patients about money. There is more burden on the patients. So patient has to pay the money for every service that they use. So today the present of the private facilities can be seen all around. In fact, now there are large companies that run hospitals and some are engaged in manufacturing and selling medicines. Medical shops are found in every corner of the country. So let's see our next point. Healthcare and equality. Is adequate healthcare available to all? What do you think? Is enough healthcare Facilities available to all? Yes. So in India, we face a situation where private services are increasing, but public services are not increasing that much. If we compare with private services, what is then available to people are mainly private hospitals or services. There are concentrated in urban areas, so they don't go in rural area, so it is not equal in rural and the in urban areas, as these services are run for profit only. The cost of these services is rather high, so medicals are expensive, many people cannot afford them, for have to borrow money, then there is an illness in the family, isn't it? So private hospital has to earn its money by charging the patient. So no one would start a private hospital in areas where the not too many people live, or where people are very poor. There are some incorrect practices also that happened at private hospital to earn more money, such as, so let's see. In order to earn money, these private hospitals encourage practices that are incorrect. At times, cheaper methods, though available, are not used. For example, it is common to find doctors prescribed unnecessary medicines, isn't it? Injections and salines bottles, when tablet or simple medicines can suffice. So, such there are some incorrect practices that happened at private hospital to earn more money, such as they perform expensive procedures when cheaper one are available. So they also suggest expensive procedures, tests, more tests. Yes. So they prescribe more medicines than necessary, like medicines or injections or saline bottles. Yes, so even they perform unnecessary operations and procedure on patients. Are you agree with this? So this procedure is unfair because of just earning money, more money. They perform unnecessary operations, even some procedures on patients. In fact, barely 20% of the population can afford all the medicines that they require during the illness. So, in next point, the healthcare and equality, we have seen over the year private sector in the healthcare has been increased. So, there is more kind of specialized service, and the doctor they are available in urban areas to compare to the rural areas. So the shows that the 20% of those who can afford medicines, those who are ill can afford medicine. So 20% is the only percent of the population can actually afford the medicines. Remaining 80% goes without medicine. So therefore, role of the public sector healthcare system is prerequisite in India. So the 40% of these patients who are admitted in hospital have to borrow the money or to take the loan in order to get the treatment. So students, there are some cases where the whole and sole bread earner of the family is ill, and then ultimately the family goes into distress. The tribal area has lack of healthcare systems. So what can be done in this situation? So first of all, government should take responsibility for providing good healthcare facility in India, isn't it? Equal healthcare facility should be provided to disadvantaged group and poor group. This healthcare facilities depend on basic amenities and social condition of the people. As we say that if there is more cleanliness, there would be less breeding ground for mosquitoes and less cases of malaria, and so all these things are basically interwed or interrelated. So in Kerala in 1994, Kerala government said that the let the 40% of budget that come in and go to the panchayat, and the panchayat are dependent to manage their budget. So they don't have any control on it. 40% budget. So they have to manage for what they spend the amount in the various projects like water, food development and education, Anganwadi and healthcare. And ultimately, the scenario in the rural area improved a lot, a much faster pace. So similarly, there is another example also from the Costa Rican approach. So similarly to this, Costa Rica is one of the leading example from the South America. It is the healthiest country in the South America. So now, how does this country work around? Yes, this country says that we do not want to spend a penny or money on these defense services. All the money that should go into defense, maintenance of army should be diverted to the healthcare facilities. As a result, they have ample of funds go into healthcare facilities like safe drinking water, sanitization, nutrition, and housing. So Costa Rica is different, differently unique example that India can take point and better idea from this country. What do you think? So to sum up, now constitution say that it's a duty of state to raise the level of nutrition and the standard of the living and to improve the public health. Now, this is what is written in this constitution should be implemented in reality. What do you think? It is written in constitution, but they should implement it. All the government or public healthcare centers should implement these things. So this was the basic idea, providing you to framework about what is public health care sectors, what is private sectors, and how is the healthcare system run. Hope you understand all the points. Okay.
If you like our videos, do share them and subscribe to our channel. If you want awesome quizzes, write to us. Keep watching and keep learning with Walnut.